First tonight, a reverse in progress. COVID-19 cases up again in the Tri-County area. Thanks for watching. I'm Mark Welp.
And I'm Shelby Roberts. Health leaders say the region is back to averaging more than 100 new cases daily.
Our Durante Matthews joins us live in studio to show us which population makes up the most cases and the push to get them vaccinated. Durante?
And Mark and Shelby, an increase from just last week alone, health leaders say 38% of the area's active COVID-19 cases come from those 19 years old and younger. Now, officials are stressing the importance of getting them vaccinated, saying COVID isn't the only illness affecting children. Children, teens, and adolescents, the youngest of the Tri-County area's population, making up the majority of COVID-19 cases at 38%. Health leaders breaking it down, saying 25% of that number is affecting those 10 to 19.
And that 10 to 19, largely, except for 2 years in there, are eligible for the vaccine. So it's highly preventable in that age range.
Pierce City County's health administrator Monica Hendrickson says the majority of cases are largely happening outside of the classroom setting. She's encouraging parents to get their eligible children the shot against the virus and is sending that same message to the general population.
So that you not only protect yourself, but you protect those high-risk groups.
But when it comes to the virus landing children in the hospital, the president of OSF Children's Hospital says, thankfully, they're not seeing an influx in pediatric COVID patients.
Our daily average throughout the pandemic has ranged from about 0 to 3 patients on our inpatient unit who are COVID positive.
But on the other hand, Dr. Keith Hansen says the hospital is seeing an early spike in viral infections like RSV.
Probably because everybody's being back together after a long time apart. People didn't get exposed last year, don't have that immunity built up.
Hansen says with the respiratory viruses, many of the symptoms are the same, and it could be hard to tell what it is.
Any of these viruses could present similarly: fever, cough, shortness of breath, just kind of runny nose, could be really anything, fatigue.
He says if any symptoms present themselves, it's crucial to get your child tested to prevent the spread. And Hendrickson says people don't quarantine or isolate from a rhinovirus or RSV because so many people have had them at some capacity in their lifetime. But she says since COVID is new, that separates the two completely.